my name is Susie. In my youth, I had numerous cavities, and my gums would bleed a lot. In high school, I know I had bad breath, and my gums continued to bleed no matter what I did. When I was in my 20s, I would go to the dentist, and they would tell me I had to brush my teeth more often. I then began brushing approximately 5 times a day, and my gums would still bleed. They told me at the next visit that I had to floss more. So I would floss twice a day. I continued to brush 5 times a day. I still had what I felt was very bad breath, and my gums would continue to bleed. With each new visit to the dentist, I was told that I had severe calculus buildup and that I was not brushing my teeth and flossing my teeth and cleaning my mouth properly. I continued for approximately 5 years to brush and floss my teeth every day as I was told by the dentist. About 4 years ago, I discovered a totally different way of taking care of my mouth. Since then, and in a very short time after beginning this new technique, my gums stopped bleeding. I have no calculus or tartar in my mouth that I'm aware of, and I have very fresh breath. I'm very happy with the new system I am using.
You have heard Susie's testimony of how her mouth care changed and her mouth health changed. Now, before we get you into the mouth and show you exactly how this procedure works, we will first describe and show you a technique that will get you there if you practice. It's called the chopstick technique. You take your brush and use it as a chopstick, or you take what they call a pencil grip, and you lay your hand down, and with the fingers only, you tap, 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 tap. This gives you the proper hold and the proper maintenance of holding the brush in cleaning the mouth. Now, the brush that you use is a special brush. It's a number one. It has a maintainer that holds the bristles close together, because this brush now is going to absorb the plaque, not displace it or mix it up. And the brush has to be kept close, the bristles have to be kept close together, and this cover does it. The bristles are also a special bristle designed of Tynex nylon and textured so that it acts as a vacuum or a capillary action and draws the plaque out of the mouth into the brush. Now, you'll put your hand down, and as a pen grasp, you will tap, 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 tap. And then when you start using it in the mouth, you put the hand back on here, the fingers on here, and now again, you tap, tap, tap. There is no brushing motion. There is no side motion, and this is why it's so important to brace the hand so that the action is straight up and down and not in any one direction. Now, in order so that you can get the transition, we will take you and move the tapping on the board into having Susie put her small 2 fingers on the chin and start tapping. This is now known as the blotting technique. The brush is tapped directly into the sulcus, and by doing this through capillary action, the bristles of the brush are such designed that they absorb the plaque and draw it out in the sulcus. This is no more the idea of disturbing the plaque or stirring it around. Now we are removing the plaque, drawing it out, so that now she can clean the brush dry by sipping it. In this way, she sips the plaque out and discards it by swallowing it and goes back into the blotting again. We will follow through with all quadrants of the mouth in the same method by using an intraoral camera and showing a more complete method or procedure in doing this. Now you can see the brush in the mouth as the bristles seek their way around each tooth and into the sulcus area where the plaque is. In this way, through capillary action, the plaque is drawn out and not just disturbed as it is by brushing and swept under the gum. We will now move you to another area, which is the lower left quadrant. Now we are in the lower left quadrant. You can see we're cleaning out the sulcus around the bicuspids and the molars, and you watch the bristles of the brush as they hug around the tooth next to the teeth and enter into the sulcus area. You may think that they're not actually going in the sulcus, but if they're not, the capillary action draws down in and draws the plaque out deep down into the sulcus, probably somewhere in the vicinity of 2 and 3 millimeters. We'll now switch to the lower right quadrant. We are in the lower right quadrant and doing a similar blotting technique, taking the brush and pushing it down into the sulcus and drawing it back again. At all times you have to be conscious that your hand is resting on the chin and the bristles are not moving sideways. There should be absolutely no brushing action to this, as the bristles go in and out, in and out, in and out. Before we move to the upper anteriors, we will have the brush dried and cleaned and sipped off. You see the brush now is reversed in the upper direction. The bristles are going at about a 45-degree angle between the gum and the tooth. And again, in and out, so as to get the plaque from under the gum into the brush. And now we will transfer you to the upper right side and show you the brush action there. She's doing the upper anteriors, and she's moving over to the left side of the upper teeth. When she gets all the way to the back, she will hit the posterior behind the last tooth by turning the brush around the corner and getting the area, retromolar area. She will now take her brush out, sip it off, reverse the hold backwards, noting that she still has a pen grasp, but turning the hand around, and she's now blotting the right side. She will work all the way back again until she gets to the retromolar area, and she'll turn her brush perpendicular and do the distal of the last tooth. She will next sip the brush again and go to the lower anterior teeth and keep working posteriorly until she gets back to the molars again. We are speeding up this quite a bit to save time. It would take a little longer to do this and a little more sipping if she was actually doing it at home. She's going to go back to the distal behind the lower tooth again. And when she completes this, she'll sip her brush out, transfer over to the right side. But you notice continually that the fingers are resting, her small fingers are resting against her chin as she works her way back to the posterior area. She will sip her brush now, and we will take you to the inside or lingual surfaces of the teeth. You will note now that we are doing the inside or lingual surface on the mandibular or lower teeth. And again, the brush is going up and down and hitting down into the sulcus. Now on the inside, it's very important that you use the heel of the brush. The brush is always perpendicular to the teeth. And it's good to note that the bristle should not rock over the teeth this way, or the brush gets damaged rapidly. So you stay on the inside, and this is done, again, by setting the small finger against the chin so that you have a point of reference continually to follow. We will now move to the lower left side on the lingual. Again, you will note that we are using the brush at a 90-degree angle so that the heel of the brush and not the side is being used. You'll also note that the brush color has changed, and this is because we have changed brushes. On the lingual or the inside, we use a much shorter brush, since a long brush would interfere with the tongue and make it rather uncomfortable. Some of the bristles will manage to slip over the teeth, but if you're careful, not many will. The right side is done similarly. Susie is now doing the upper teeth on the inside or lingual, and she's starting with the front or the anterior and gradually working her way back to the right. We are now on the left side working back. And again, you note that we're using the heel of the brush, being careful that the bristles don't crowd on top of the teeth. Next, we'll switch to bristle flossing. Here, the bristles of the toe of the brush are pressed up in the interproximal spaces, and they are made to go through to the lingual. You can actually see the bristles come through with the camera on the lingual. Note that the brush has to be pulled back completely, since it's only the very tip of the bristle that cleans, and not the side. So getting the bristle up in there and sliding it back and forth is not enough to clean it. You have to pull it out completely and slide the bristles up through again. Now cleaning the soft tissue. Since it's not much sense in cleaning the teeth until the total mouth is cleaned first, we will have Susie go through and clean her cheeks, the vestibule areas, the gums themselves. And if you'll note, in doing this, she often sips the brush to keep it dry and absorbent. The last thing she'll clean now will be her tongue. Her tongue has to be cleaned posteriorly to the throat. This is real important, since the quality of breath is dependent upon the hygiene on the tongue. Actually, if she was doing this at home, she would always begin with the tongue, work her way to the cheeks, the gums, and then the blotting of the sulcus, the interproximal spaces, and finally the chewing surface, which she will demonstrate now. This is done by placing the bristles on the teeth and chewing lightly on the brush itself. This forces the bristles into the crevices on the occlusal surface of the molars and bicuspids, and in reversing the brush upward and the same chewing action then cleans the occlusal surface on the maxillary teeth. We have now completed the total mouth hygiene. You have seen Susie demonstrate the cleaning. You have seen the inside of the mouth. You have heard the testimony. However, we probably should still review on the models, since it's easier to see and easier to associate a model working on the outside than it is the mouth. Even though Susie didn't do any brushing with toothpaste, it isn't that we don't believe in toothpaste brushing. It's just that toothpaste brushing serves as a cosmetic aid, not as much of keeping the mouth clean. Because I can show you a couple of models here and a rug on what happens when you brush. Now, this cuff around the tooth is elastic, and it has to be kept tight. As soon as plaque gets in here and the lysozymes from the dead cells start to destroy this tissue, then this area opens up, and now you have a place for the plaque to hide. This can well be demonstrated on the model by using a rug. When you sweep, it's just like if you have a dirty floor. And now we have a floor here with dirt all over it, and we'll say this is the tooth. In fact, we can draw this area into a tooth. And the rug then is the cuff or the gum. Now, if you brush these teeth, you will find when you get through brushing, you have some of the plaque has gone into the brush, but most of the plaque is found underneath the gum. And this would be the same as having this gum here. This gum here, when you brush like this, in fact, we could even try and put some on here. It's going to be a little difficult, but we probably can get it in here. And in sweeping or brushing, you can note that most of this ended up down here. This would have been your plaque that you brushed away. The plaque that you saw go under the rug is under the rug or under the gum here. And as you brushed it, you've brushed it in there. Now, we do not check plaque with disclosing tablets because they do not show us where the damaging plaque really is. We do it with a brush we call a plaque checker. This is an oversized plaque checker. However, it'll show you exactly by thrusting the brush into the sulcus with a dark brush, dark bristle brush, or into the sulcus here. You pick up this plaque, white material, and you can now see where the plaque really is. Once the mouth is thoroughly cleaned, a brush going in here should not pick any plaque up. We'll now transfer you to a small model, and on this model here we'll use a small plaque checker. Here we'll thrust the brush into the proximal spaces where some plaque has been placed before. You can see the plaque on the brush. Now this is very indicative of an unclean mouth. A mouth may look very clean after it's been brushed and flossed. However, when you thrust this plaque checker brush into these areas, you'll soon see that the cleaning has not been done. Now, let's review here using this brush and the blotting technique, and the bristles again are thrust directly into the sulcus area. The brush is a capillary action type of brush. We'll now take you to a small life-size model and have you take a look at true case of periodontal disease that may not be too bad as far as pockets are concerned, pockets of depths in the bone. However, with good mouth care, this gingivitis rapidly disappears. Now we go to a model here that shows deeper pockets, and we'll use the handle here as a probe. And you'll notice that we're probing the pockets down to a depth of wherever they are. To sum this up slightly, we'll take a tooth here and we'll put it through the blotting technique. In fact, we probably should put it through the brushing technique first. And I don't really mind which way you brush, as long as you blot after you brush. Now, it's a good idea to brush in the morning because brushing is primarily cosmetic. So you brush your teeth, and then you blot them. You can blot them on your way to work, or you can blot them during coffee break. And then the rest of the day, really, blotting is adequate. And if you blot in the evening, you should be able to have a healthy mouth, pleasant breath continually. Thank you.